Hi, I'm Dr. Luga Podesta, and we're going to talk about stress fractures today. Stress fracture is actually a microscopic fracture that we won't see on an X-ray. Stress fractures usually occur in weight-bearing bones. Here we see the bones in the foot. You can see there's no abnormalities that we can see. But if we look closely, especially with an imaging study, you see this highlighted area, which can represent a stress reaction or fracture. In my particular office, I see more stress fractures occurring in the feet and in the spine. Throwing athletes can get it in the humerus or their arm bone. Rowers get it in their ribs from repetitive pulling. You can get it in essentially any bone that's weight-bearing, and that applied stress can occur. The initial treatment is really recognizing that it's there. Most athletes will wait and see whether or not this pain goes away that they're experiencing in their foot or in their shin. Commonly mistake the tibial stress fractures for shin splints or the spine stress fractures for muscle pulls. Unfortunately, if it goes on too late and a true fracture occurs, then it becomes much more difficult to heal. Initially, we'll take an X-ray. Most of the time, an X-ray won't show a stress fracture, especially if it's new. So we go on to a different imaging study. If you think you have a stress fracture, it becomes important that you see a physician as soon as possible before it gets too late or a true fracture occurs. Then he'll be able to do the appropriate imaging study, such as an MRI, to make the differential diagnosis. To treat a stress fracture, it's relatively easy. It's basically unload that body part from the stresses that are applied that would actually cause it. So if you're a runner or a basketball player constantly jumping on your foot, we need to be able to stop that and then allow the bone to heal over a period of 2 to 6 weeks, and then eventually gradually increase your activity level and stresses that are applied across that bone.